second of it. But is there some couple of little things that you could show, like a couple of tips or tricks or something that you could, therapists out there that might say, like, I get someone who comes in with neck pain or headaches or something that you could go, yeah, if you do this neuroimmune reset, is there anything like that that's easy to show?
Yeah, so some of them they're probably going to be familiar with because of the things that you teach. A lot of these points are very, very similar, right? So it's like, hey, man, if it works, keep on doing it, right? Some of my work might be a little bit deeper than superficial work because I go after the organs a lot. The organs are what they call visceral work.
Well, I'd love to see.
I'm not sure if you do a lot of that.
No, yeah. I don't, but I'd love to see a couple of clever little visceral resets.
Yeah, I'll show you that. It's pretty simple, basic ones, because I find that a lot of people don't have a good motion of the organs themselves in relationship to each other, but also of the rest of the body. Because when you move your torso, for instance, and you rotate left and right, I mean, the organs need to kind of glide up underneath, like shear with each other. And they're stuck most of the time because there might be so much inflammation in the abdominal region that you're not aware of until somebody sticks their fingers there and you're like, wow, that really sucks. Because you know how much fun it is around the navel, right?
Yeah.
So I work there. But also one of the things that I tell people is just like you, when you teach good observation skills, just really begin to pay attention to the face in particular, because the face reveals, one, remember how you said the polyvagal about the smile, and just looking at the lines on the face, looking at the marks on the face, looking at the colors on the face. When you'll see, anytime you have an issue with lymphatics or organs, they will typically manifest somewhere on the body, but they'll manifest on the face a lot. So wherever I see issues on the face, that indicates I might want to start to go there. And the cheeks are a big one. So a lot of people will get like redness on the cheeks, a little puffiness in the cheeks, acne on the cheeks. And that is indicative of most of the time issues with the lungs themselves.
Okay.
The lungs and the large intestine. So I'll go to those particular places. And usually that means I've got to do a lot of work around the sternum or the lung area. Very, very toxic. Also, just a little side note that's kind of interesting. When people have a lot of redness around the cheeks, it's usually indicative of a low amount of stomach acid, hydrochloric acid.
Oh, wow.
So usually will increase the intake of stomach acid. You're checking, right? Which will help your body with the lymphatics anyway, because you're able to break down protein much more effectively. Then I usually tell people, try to take a little bit of hydrochloric acid or maybe a couple of caps of apple cider vinegar mixed into things and see how you feel. But I try to pay a lot of attention to the real estate from the top of the sternum down to the bottom of the navel. Because it's, in my experience, one of the most neglected areas of the human body because it rarely hurts on its own.
Okay, yeah. It doesn't hurt till you
hurt,
push it.
Yeah. Yeah, you hurt in your shoulders, you'll hurt in your hips or your neck, or usually you'll hurt in your spine somewhere. Yeah. The middle of the back, the lower back are pretty big ones. And so in our world, if it doesn't hurt, right, on a daily basis, or you have pain there, it's perfectly fine. Not so much, right? The two, I'll show you what it's called. Are people going to see this on video?
Yeah, this is going to
be. I'll stand up and I'll show you a couple of places that we check. Now, one of them I know that you teach is one of my favorites, is if you just assess right in the middle of the sternum in and of itself, between the two pectorals or the breast tissue. It is usually very tender, puffy, or swollen in this region, and it's not supposed to be. It's supposed to be hard, like the breastplate. And I stimulate that, and I look to see if it's tender, puffy, or swollen. And you know that that's the heart chakra that sits there. but also your thymus gland sits back there, which is part of your immune system, as well as holy cow, your heart sits there. It's the heart chakra. But that is also the area where the thoracic duct carrying the lymph from the lower part of the body separates off to go to the left side of the neck. So it gets puppy right there. So I rub that way. And then that's honestly one of the most powerful neurological points for your body. Then I'm going to go down to the bottom of the rib cage. So I'm going to stand up here so you guys can see me. And let me get my thing so I can see myself. Okay, so I'm going to do this standing up. You can do this lying down. It's probably a little bit easier than standing up, but you know, you've got the bottom of the rib cages here. I call this your umbrella right here. And of course the diaphragm sits here. And when you breathe in, the diaphragm drops, which pushes your organs towards your pelvic floor.
Yeah.
Then when you exhale, all the organs and the diaphragm ricochets up, and then you have this pumping mechanism, and the pump is supposed to move fluid. That's what it's supposed to do.
Yeah.
Right here. And you usually get so much tension underneath the ribs because people are slouched or they tilt and they're hunched over, and then it's just like taking my shirt and it becomes super tight. It's hard for me to raise my arm. It's hard for me to extend my hip. It's hard for me to rotate. It's hard for me to breathe. So it's a very simple one where you can just do a scooping motion. So you can use your hands, or you can use, let me just get a little ball here really fast.
Sure.
So you can have someone do it to you, or you can do it to yourself. So it's a scoop where you can either take your fingers or you can take a knife edge up underneath. And then all you're going to do is scoop down away from that rib cage towards the opposite hip or towards the navel. And if I'm on the left side now, I'm going to affect the tension around my spleen, my stomach, and my pancreas that gets stuck there. And I'll just do a scoop down towards the navel 4 times this way. And then I'll do the same thing on the right. And then now I'm going to get the liver and the gallbladder a lot. And then I'm just going to pull down up underneath. And I forget what reflex point sits under there. Is that the quad?
The quads, yeah.
Yeah. So, you know, that's going to make sense for me, because if this is tight, I'm not going to be able to really use my quads quite well.
Yeah.
Then I'll do the 4-corner scoop the other way, like that. Or if I want, I can use a ball like this, and the ball locks in there. And if I'm on the skin, it's even better because I can pull the skin a little bit. And you can see when I go, it'll pull the shoulder down a little bit.
Yep.
That way. So then I'm going to I'm going to affect the ligaments of the liver and everything that's going to help my motion in my shoulder. So I'm going to go there. And then the place that I like to spend some time after I do the scoop is I find the center of my navel. I find the bottom of the sternum or the top of the abdominal region. And I find the distance about halfway. That's usually the space that you're going to go. And then that right there, if you look at this, that's the center point of drawing an X from tip to shoulder.
Yeah.
So that's the center point of drawing in. If you're not sure where it is, curl in and then write that. That's the spot. And it's also the center of rotation here. And I'm just going to stick my fingers in this region here, right? And then there's a couple different ways you can stimulate it. You can just come in and scoop up a little bit, nice and easy there to get that going. Or you can inhale through the nose and then you exhale through the mouth, and it's going to look like this. So I'm inhale, exhale, and as I exhale, I go like this.
Oh, like CPR.
Yeah, I'm doing CPR, but I'm doing it way down from your heart.
Yeah.
And that's going to move the largest lymph node in the body called the cisterna chyli, so it'll get that pump going. It's also a highly emotional point, so many people will let loose and cry or exhibit many emotions from that region. So that's called the emotional center of the body. In Eastern medicine, it's called your chi point.
Yeah.
And if you can just do the scoop and then you do in there 4 times, it can make a massive difference on everyone. So those places, just the sternum, scoop here, I
Yeah.
do that on everyone for anything and everything, and your students will know just what points that those correspond with, which is sort of a lot.
Yeah.